Hello, Whitney Oaks staff. This is Kyle, your administrator. There's a lot of tension out there these days, a lot of anxiety and a lot of misinformation. If you were to listen strictly just to the local news, you might think that the sky is falling. And I'm here to put your mind at ease that that is not the case. At this time at Whitney Oaks, we have no patients that are under any isolation whatsoever. That means we don't have anybody who is on a contact isolation, and we don't have anybody who's on droplet precautions. Currently, we have no patients who are running fevers in the facility. We continue to admit patients, but we screen all of those patients, and we screen the patient when they come to the front door to make sure that they don't have a fever. We currently have a no admit COVID-19 policy. And so at this point in time, even if the hospital wanted to send us a patient with COVID-19, we are not accepting those patients. There would only be a point in time where if there was a larger emergency and the hospitals are flooded, that at that point in time we may be obligated by the public health to take some of those patients in the future. But at this moment, that's not the case. We are asking staff to continue to be vigilant in their infection prevention, infection control, good hand washing, good social distancing. Don't forget that. We have asked our housekeepers, and they have done a great job increasing the amount of cleaning that they do, and especially in the high touch areas. We just received in over 1,000 face masks, the procedure masks this week. So we have those back in stock, which we're very happy about. And we have a large order of masks and gowns coming from overseas. And so that's going to take us a little bit of time to get there. But that was kind of started that, let's slow the curve down a little bit in terms of helping facilities like ours get better prepared ahead of time. And so we want you to know that at this point in time, coming to work, you're essential. We need you here. Our residents need you here. And until such time where there are higher risk factors or people who have high risk conditions, we would anticipate that the staff should show up for their normal shifts. If you're comfortable wearing a mask that you bring from home, then we're fine with that. If we have any residents that have isolation needs, we would provide the isolation masks and gowns as needed. At this time, as I mentioned before, that's not the case. We don't have anybody on isolation, which we're pleased with. We do want to thank all of you who have been coming diligently and working hard in spite of all the different challenges, whether it be daycare or just anxiety or fear. The great thing is that in healthcare, we're somewhat recession-proof in that people still need healthcare. And so we're fortunate that we've been able to come to work and get a paycheck and be able to continue to take care of our obligations and responsibilities. We do have our our infection control certified nurse that you could certainly ask Darlene if you have any lingering questions you're unsure of. Michelle as well. Nikki is another person who is an infection control certified nurse. And we are drawing upon the resources of Plum Healthcare to use their infection control specialist, as well as Sue Sherman, who is overseeing the clinical. We're having 3 times a week calls currently to just talk about what our isolation issues are, how many beds that we have available, any equipment that we might need that we can shift around between sister facilities if that were to come and there was a need for that. So we're trying to plan for all of our contingencies if they were to come to pass that way. And we're hoping that with some of this continued isolation and social distancing, that will help continue to minimize things. And so more information obviously will continue to develop as things are fluid. As you know, we have not had visitors in the building, and only essential folks or family members where their family members on hospice. So we've really reduced the number of people who are coming in and out. We did receive notice that some school districts have extended their at-home programs at least until May 1st, and that may very well end up being at the end of the school year, depending on how things go. So my message to you more than anything today is it's business as usual. If we get to a situation where we are concerned or we're having patients where we're going to have to admit COVID-19 patients, even if they have mild symptoms, we will let you know. There's no secrets. We all have to be on the same page in terms of protecting ourselves and protecting our residents and protecting their roommates as well. And so as you come, it brings normalcy to our residents who are already kind of out of their normal schedule. And we're not just granting leave of absences for staff members because they're nervous about working in healthcare. We've been exposed to all sorts of things like MRSA and VRE and CRE and all kinds of different bugs over the years that are actually pretty substantial. And as long as we practice good infection control and as long as we practice good hand washing, and when we get home at the end of our shift, we launder our uniform and leave our shoes at the door and take a shower, there's continues to reduce the risk of you bringing something home to the family and or sharing that, and likewise having the social distancing where others aren't coming to your home or you're not going to other people's home will also continue to reduce that risk factor as well. And so if you have questions, please feel free to reach out to us. We do know that people are nervous. I've talked to many of you who've shared confidentially with me that you're nervous about things, and it's kind of an unprecedented time, and because there are still some unknowns, that does make us a little bit nervous, and that's okay. But more importantly, we want you to be able to come and ask us questions and not just not show up or decide that I'm just not going to do this, especially when there's such a large need for what we have. And many of our patients you're familiar with, and they see you as family, and we certainly need you and being able to help take care of really the most frail of those out in the community. And so while there's still the shutdown globally, here in the facility, we continue to need your assistance. So we wish you well. We hope for the best in terms of your health and your family's health, and would just ask for your continued support. And if you need clarifications on anything, please reach out to our staff and get information from real sources like the CDC or the World Health Organization, and not your local news that oftentimes sensationalizes things, and you don't get as good of information. We're in constant contact with federal, state, and local officials on this subject, and as we have new information, we will share that with you. God bless you all. Have a great day, and we will see you in the hallways. Take care. Bye-bye.